Well, the reality is that we don't have limitless resources, and we cannot continue with the levels of, lab testing and personnel that we have been using. That doesn't mean that things might not change again.
The province of Manitoba announcing Thursday that provincial COVID-19 test sites will reduce their hours as of April 1st, and that the sites will close altogether as of the 15th. Instead, PCR tests will be available at pharmacies and family doctors, with rapid tests still available at some grocery stores and libraries. But some in the health community are warning that the province is moving too fast to close down these sites.
My first thought goes to safety nets and people who may need testing, but it is not as easy for them to go to one of the locations to get the test. I understand that there will be multiple locations for people to get tests. Of course, it will be seen how many tests are actually available. So that will be an issue. Will there be, for example, a website where people can check before they go what the inventory might be of tests? I don't know if that's a possibility, but my primary concern is, people falling through the gaps, those hard to reach population that may be at higher risk.
Though vaccination rates are up and there is a better understanding of the virus, PCR tests add essential data that could help should an outbreak or a new variant occur.
But if we're not doing enough surveillance and that would be done through PCR testing and sequencing, then there's a risk there for us not kind of being on top of our game in following enough data to be triggered to know if something has changed.
Carr does believe that communication is key and wonders what steps the province has in place should case counts continue to rise.
And I think the public needs to be reassured that there is a plan. What exactly is the plan? What are the triggers for reopening testing, for example, and perhaps for enhanced reporting back to Manitobans so that they do understand out of sight and out of mind does not mean that the virus is not circulating. In fact, it's ideal conditions for the virus to continue to spread.
Having done away with announcing daily case counts in the province, the first weekly update Thursday shows 11 people have died from the virus and 111 have been hospitalized in the last 6 days, though the province remains in the green category of the response system. In Winnipeg, Brianne Foley, City News.